Hi, I'm Christy Michael, a doctor at Bonheur Children's Hospital.
And I'm Raisha Montgomery, a community health educator with CHAMP, Bonheur's Community Asthma Program. And we're here to talk about asthma, school, and you.
First, the basics. What is asthma? Let's make this simple. You know that you breathe through your lungs. Inside your lungs are little tunnels or air passages. They sort of look like this. When you breathe, air goes into these tubes. Your body takes the oxygen to use, then the remaining air goes back out. When a person has an asthma attack, three things happen to the tubes, making it harder to take air in and very hard to get air out. First, there are bands around the outside of the tube. They start squeezing, making the tube opening much smaller, so you can't get as much air in or out. Second, the inside of the tube gets swollen. Now it's even harder to push air. As if that's not bad enough, the third thing happens. Mucus starts to form inside the tube, making it even harder to breathe. Now mucus is, I don't want to be impolite, but let's face it, mucus is just another word for snot. So that's what an asthma attack is, the three S's: squeeze, swell, and snot, all adding up to difficulty breathing, usually when either a wheezing sound or with a lot of coughing. It varies by person.
So, if that's what happens during an asthma attack, what causes them? Well, asthma starts when something irritates your lungs. Those small airways that Dr. Michael talked about are very sensitive. Are you one of those people that sneezes when you smell a flower or when the trees are blooming? We call that having an allergy. And asthma attacks are usually triggered by things that you're allergic to. People with asthma are often allergic to things like flowers, trees, grass, dust, cockroaches. The list can go on, and everyone is different. Other things that can trigger an attack are changes in the weather, strong smells, emotions, and illnesses like a cold or the flu. Again, all people with asthma are different, and different things affect people differently. It's important for you to know what your triggers are.
But there's good news too. Asthma can be managed. The first thing you need to do if you think you might have asthma is go see your doctor. Just because you wheeze once or twice doesn't mean you have asthma, so you need a doctor to help find out.
If you are diagnosed, your doctor will give you prescriptions and an asthma action plan. You need to learn what this medicine is for and how it works. Memorize it. Take the medication as prescribed on your plan.
Also, you'll need to reduce your asthma triggers. Your doctor will help you learn more about the things you're allergic to, the things that can set off an asthma attack. They may be things you eat or something in your home like dust, mold, or mildew, or something you do like run and play hard. Learn what these triggers are and avoid or manage them.
You have to learn to recognize your symptoms. If you take medicine when you first start to wheeze, you can manage your asthma and prevent a major, very bad, super duper asthma attack. The earlier, the better.
Yes, be aware of how you feel. Even if you're doing something really fun, if you feel shortness of breath, chest tightness, coughing, dry mouth, tell someone and don't wait. If you're feeling funny or different, don't wait. Take your rescue medication as prescribed. Follow your asthma action plan.
This goes for parents and other adults as well. Be alert. If you think your child is acting differently or is withdrawn or even too quiet, remove the child from the activity. Let them sit quietly and catch breath. See if they feel better, then bring out their asthma action plan and medication. If you suspect an attack, don't wait.
And when it's time to use your medication, always use a spacer. A spacer is a tube that helps the medicine get into the lungs. It's important for you to use a spacer when you take your inhaled medication because without it, your medicine is not as effective. So if you're away from home, like at school or visiting a relative, make sure you take your medication with you and take your spacer.
Other than their home, children spend more time at school than anywhere else, so it's very important that all the adults involved in caring for a child are up to speed on how to manage asthma. This is important because when children miss school, it makes it hard to catch up with the class when they return. Absences also get in the way of moms and dads going to work, so anything we can do to manage asthma at school helps the whole family. First, parents, make sure the school staff knows that your child has asthma. They cannot help you if they do not know. Second, your child will need to have medications and a spacer available at school just in case. This means that at their first of the year, parents need to complete the school's asthma action plan. Your school nurse can help you with that.
Bring the medication to the school in the original packaging. Make sure that you don't send the only medication you have to school, because it can't be returned at the end of each day. If you need extras, your doctor can write you a second, school-only prescription. The school meds stay at the school. If a child is old enough to carry his or her own medication, then the child's doctor needs to sign a form to allow for this. And that form needs to be taken to the school by a parent.
Be sure to take your child to see your doctor every year to get checked out. Once you have the annual physical, your doctor is available to help you if you get sick with asthma or anything else. And hey, while you're there, please get a flu shot.
And always open all letters from your health insurance company. Some insurance plans, particularly TennCare, will send a letter to a family every so often so they can make sure that you still live in the same place and still have the same circumstances as when you applied. Don't ignore these letters.
Whatever it says, it is better to deal with it sooner rather than later. And if you don't open the letter, you could lose your insurance, and it takes about 3 months to get it back.
Teachers, if you have a child identified with asthma in your classroom, be aware of the possible early signs of an asthma attack and respond to get help for the child. Talk to the parents and the child to learn more about the typical warning signs experienced by specific children. Manage allergens and asthma triggers in the classroom. Things like air fresheners, perfumes, or class pets can all be potential hazards for a child with asthma.
Children whose asthma is well managed can typically play sports as other children, but it may require some extra actions. If you have a child with asthma on a team or in PE class, make sure you have a copy of the asthma action plan. Talk to the parents and the child to learn more about the typical warning signs experienced by specific children.
We hope that this has been helpful, and if you have any additional questions or concerns related to your child's asthma, there is a lot more information about asthma and other child health topics at lebonheur.org/parenting.